Okay, so good morning, everyone. Thank you for joining us here today for a conversation with our Durham Region's top doctors. My name is Nicole Gibson. I am the Executive Director of the Ajax-Pickering Board of Trade. I'd like to start first by congratulating all of you on making it through the past few months. What a ride. It no doubt took courage, dedication, and likely quite a bit of flexibility to find a path that is right for you, your business, and your clients. Today, we'd like to reflect on some changes that you may have made in your workplace, and we'll do our best to answer any questions you may have about the measures you should have in place as we begin to reopen. Make sure you get your pressing questions up to the top of the queue by typing them as we move through the presentation in the Q&A box you'll find at the bottom of your screen. Before I introduce you to our dream team of doctors and experts who will be tackling your questions, I'd like to tell you a little bit about what the Board of Trade has been doing to help our members and the business community during COVID-19. To inform ourselves about the impact of our members, we released a survey with nearly 100 member responses. We've also been engaged on a call campaign reaching out to all of our memberships of different size and sectors of business. To get an idea of the broader impact to the region, we're also proud to be members of the Durham Economic Task Force, which is led by the region of Durham and has been releasing surveys, hosting events, and providing tools with a focus on recovery. We've been actively engaging our elected officials, hosting our own business recovery roundtable, and participating in numerous others. We've sent a number of letters, which you can find on our website, apboardoftrade.com, on a variety of topics, from new patio rules for restaurants to financial program changes to PPE supports for businesses in need. For members who have reached out, we've been able to provide one-on-one support to provide the information or connection to officials or fellow business leaders they need. We hope you will all continue to reach out to ourselves, to myself and our staff, and share with us what is working and what isn't at all levels of government, so we can continue to react and adapt to the changes in the economy as a result of this pandemic. Now I would like to thank and welcome our guests who are here with us today to respond to your questions. Joining us from the Durham Region Health Department are Dr. Robert Kyle, Durham Region Medical Officer of Health, Dr. Pepi McTavish, Assistant Medical Officer of Health, and Lisa Fortuna, Director, Health Protection. Should you have any questions on the topic of employment law, we also have joining us our 2020 Chair and Partner with Vukelich LLP, and no stranger to the Board of Trade, Christine Ashton. So I'd like to get things underway by inviting our friends from Durham Region Health Department to share their presentation to help us understand the work they've been doing and the current status of the COVID-19 here at home. So over to Dr. McTavish.
I'm going to share my screen here, bear with me. There we go. So thank you so much for having us this morning. So Lisa Fortuna, our Director of Health Protection, and I will give you a brief overview of sort of what we've been up to at the Health Department and just a little bit about reopening. And then we are happy to take any questions that you have. And Dr. Kyle is here also to answer questions. So, and especially with the lawyer, hopefully we can answer every question people have today. So with that, thanks so much for having us. So first here, I can't tell, can you see the numbers or am I here? When I share my screen, I'm just making sure that you can't see my face as well, covering the boxes. Okay, here we go. So here's just some numbers, our health response to COVID-19 so far. So these numbers were current as of the 23rd, but as of this morning, they're a little bit higher for the total number of cases. So as of this morning in Durham, we have 1,677 cases. The total number of deaths, unfortunately, is 180, and that still remains at 180, thankfully. And this is 11% of our total cases in the region in Durham. And you'll note that right under that, you'll see that proportionally, many of our deaths here in Durham have actually occurred in individuals who live in long-term care homes and retirement homes. And that is replicated across the province, unfortunately. A little bit of good news, though, is currently we only have 2 long-term care outbreaks, which is wonderful. We've had a lot of outbreaks, so we are seeing a downward trend here. And the total number of outbreaks that have concluded have been 32. So you'll see here on the right-hand side of the screen, this is the new cases of COVID-19 by the case reported date in Durham. So even if you blur your eyes a little bit and look at this graph, you can definitely see that there's a decrease in the number of cases, which is nice to see. So the green is currently the active cases. You can see they're on the right-hand side. So a smaller number, but certainly still some active cases. And yellow is unfortunately the deaths, but you'll see a lot of blue. So a lot of resolved cases, which is great to see. And just for context, so we have, about 1,677 cases in Durham right now. In Ontario, it's just over 34,000, and for Canada, it's just over 102,000. So everyone's been working extremely hard at the health department. So as of the 22nd, we'll just go through a few quick numbers so everyone knows how hard we've been working. Over 80,000 phone interactions, so many people call the Durham Health Connect line, they have questions, a lot of great information available there. Been over 20,000 assessments. So I'll speak a little bit about it, but when the nurses do the case in contact investigation, they're in constant contact with the cases about how they're feeling and if they need to seek further medical assessment. There's been over 1,000 investigations for our priority populations. These are our shelter populations, group homes. There's been over 2,000 follow-ups with our long-term care homes and retirement homes. There's been a great deal of work with both our health protection division and our population health division with these important groups. And there's been over 33,000 calls to our paramedics, and almost 20,000 of these were transported to hospital in relation to COVID-19. So here's just a nice infographic. So this is again as of the 22nd. I won't review the numbers we've just spoken about, but I'd like to draw your attention to this 8,450 testing kits prepared. So there is a great deal of work that's happening behind the scenes to help support the paramedics who are doing our testing, as well as our community partners. And here you'll see that there's 28 outbreaks managed by the inspectors in the long-term care homes, and that's different than the 32 you saw on the first page, because the 32 includes our local hospital outbreaks of COVID-19, which the health department is involved in, but much less. So here we mentioned the phone interactions. There's a lot. I will draw your attention here to the 4,825 cases and contacts managed by the public health nurses. So anybody who is a case and their close contacts, the nurses phone and manage and assist with all levels of support for these individuals. And here you'll see 4,950. This is over 5,000 now. Our paramedics have done a great job, and they're very proud of this over 5,000 number. So they've been going out and helping us with our surveillance testing, which we'll discuss in a minute. So right now over 5,000. So they obtain the nasal swabs or the throat swabs for our surveillance testing, and we'll discuss that in a bit. Our website, as you can see here, gets a lot of hits. I bet this is over 435,000 now. We have a great website, and we will drive you to that in our resources at the end of the presentation. And here in the light blue box, this is about Dr. Kyle's Section 22 class order. So on April 7th, he issued a class order, which basically means that anybody who has COVID-19 or is a close contact or is suspected of having COVID-19 needs to self-isolate. And other public health units did this as well across Ontario, which is another tool in Dr. Kyle's tool belt to help control COVID-19 in the region. So 55 investigations here by the public health inspectors for people who were positive, but perhaps we weren't aware of them yet or weren't following up with us. And 34 investigations as well for people who weren't self-isolating. So here is a bit of a pride and joy for Durham, the health department. We have a wonderful website about our COVID information. So this is durham.ca/novel coronavirus, and then you can get to our data tracker, or you can get to it alone at durham.ca/COVID cases. So here there's 6 main headings, or there's 5 now. They'll be fixed by end of today. So the one on the left, there are cases. We have, so this would be sort of the first page I showed you. It has the number of cases, how many deaths there's been, how many new cases. The second heading is in institutional outbreaks, and many people check there to see, what home is an outbreak, when is the outbreak over. It's very detailed. It tells you if staff or a resident who's sick, and if it's over or not. There's trend data, time data. So on the first slide, I showed you again that graph. So that's shown there, the trend data. We have a section on exposure. So are they close contacts? Was it a community case? There's just a bit more information there about how people may have been exposed to COVID-19. And then there is the map of cases by health neighborhood, which is shown here as well. So there's 50 health neighborhoods across Durham Region. It's broken down, so you can hover over here and see the cases per 100,000. And I'll draw your attention here. Not sure if you can see my scroller here, But you can click here and it'll exclude the outbreak homes. So this includes right now the long-term care homes. So for example, if you live in an area that's had a large long-term care home outbreak, if you look at it, you might be more blue. And then if you click here and if you exclude the home, it would show you more of the community cases. And then monitoring indicators here, this last one. So this comes live, we're hoping this afternoon, which will be wonderful. So these monitoring indicators are what the province is using to look at sort of bringing us into these new phases and stages, sort of is it safe for opening. So these indicators include things, for example, the test turnaround time. So if you get a COVID test, how long till it turns around, so you get the result back, how many acute care beds are open, how many people are on ventilators in the ICU. For public health, we look at how long it takes us to get in contact with a case, and we'll discuss that in a little bit. So lots of great information, so look for this later today when it goes live. So here's our surveillance testing. So many of you may have heard there was provincial direction about a month ago now for the health department and all the public health units to assist with surveillance testing in long-term care homes. So we were able to do that with the help of our paramedics. So within 2 weeks, we were able to test every staff and resident in all the long-term care homes and emergency child care centers. So this was achieved a few days early by our paramedics. So right now, there's been no direction to test in retirement homes and other congregate settings such as group homes and shelters, but we've been doing this anyway to get a better sense of what the local surveillance data is locally. And we're very happy to say that we're done the retirement homes, almost done. I think there's a few more trickling in, a few more labs, but we've only found 2 cases, 2 asymptomatic positive cases in over 3,000 swabs, which I think is really great, and it's very telling for us what's happening out in our community. And we will begin work very short. Well, we're doing it already, but it's not completed on the migrant farm workers. And you may have heard that in the news in the past few days. There's been a little bit more provincial lens on this vulnerable group for COVID-19. And again, just here, the paramedics have collected over 5,000 swabs, and over 3,000 of those were in the retirement homes. So here is sort of the bread and butter work that our nurses do for the case and contact management. So this is the investigation. You figure out where a case has been, what their risks are, what their exposure may be. And then the contact piece is the people who have had close contact with the case who may be at risk. So the Ministry of Health, the goal, so this is one of those reopening goals, is that 90% of newly identified cases are contacted by their local public health unit within 24 hours for when we get the lab slip and we know they're positive. And we have consistently been at over 99% here, almost always at 100%, which is excellent. And many health units are like that as well. And we report on this, I believe it's weekly, it might actually be more than that, up to the province. And then we also look at the number of contacts. So not only the case, but let's say a case has 3 contacts we identify, how long does it take us to reach these contacts? And we are always, almost always over 99% of getting in contact with the contacts within 24 hours. And I will pass it over to Lisa for the provincial framework. And then Lisa, you just tell me when to go to the next slide. And I will go on mute.
Okay, great. Thank you very much. So this is the provincial framework for reopening. And as you're all aware, we have gone into phase 2. So next slide, please. Okay. So the province did announce that Durham Region was allowed to move to stage 2 on December 19th. And so stage 2 allows for the reopening of many businesses and workplaces, including personal service settings, recreational facilities, restaurants and bars, specifically patios. At this point, patrons are not allowed into the restaurant, basically just to use the washroom and to pay, but there is no seating inside at this point. And shopping malls. There is a complete list on the Ontario website as well. So dates and approaches for reopening have varied across the communities. What we have noticed is that the local area municipalities and businesses, they really want to make sure that they are ready and able to meet the requirements before opening. So even though they have been given a date or were given a date that they could open, we have noticed that some have delayed their opening, make sure they're safe. Next slide, please. So we did create a new online community reopening toolkit, and it has a lot of valuable information, including downloadable signage and flyers that you would find useful in your business and also in the community. This was launched on May the 29th. The toolkit includes links to resources from a variety of industry agencies and numerous guidance documents for sector-specific businesses and services. The toolkit is continually updated as new openings and information becomes available. And if we enter and when phase 3, we'll continue to update the information. Next slide, please. So this is a screenshot of what the toolkit looks like. We also have information on the website for Invest Durham. Next slide, please. So again, this is a screenshot of the sector-specific guidance that we do have. There is a lot of information on there, and we couldn't put everything on there. So there is a link that does take you back to the Ontario government website, and they have over 170 sector-specific guidelines. Next slide, please. So just some of the work that we have been doing internally at the region to prepare for our, I guess, getting back to work. We are still continuing to be the public health priority towards the restoration. So we are continuing obviously with our COVID-19 work and trying to adjust to our new normal. Our planned restoration period is from July to September. And during that, we'll be identifying programs and services to be restored and associated timelines, including our staff returning to the office. As you know, there are still several unknowns, and the plan will be adjusted as new information becomes available. The restoration of programs will be implemented and staged according to when staff can be released from our COVID-19 activities and when new resources and methodologies to support COVID-19 response are implemented. Next slide, please. So activities to begin during the restoration period include clinic services, support to at-risk families, priority immunization activities, including planning for the influenza season and health protection inspections. COVID-19 will change the way the health department provides services. We have learned a lot through this. Recommended strategies to minimize risks associated with in-person encounters, including telemedicine approaches, are currently being reviewed. Next slide, please. So some of our return to work recommendations, we have created some guidance for the region and the local area municipalities to support the gradual reopening and return to work. Now that there is a thorough Ontario website, resources to prevent COVID-19 in the workplace. Sorry, that was my cat. A site or job-specific risk assessment is recommended to determine what job hazards and infection risks are present and what engineering and administrative controls or personal protective equipment are necessary for the protection of employees and the public. Phased reintroduction of staff is recommended to support ongoing requirements for physical distancing. Next slide, please. So as Pepi mentioned, this is our list of resources, and there is a lot of information on there. So please, please feel free to look at those. And as I did mention, the community reopening toolkit, there is a wealth of information on there, and it is continually being updated. And that's it for me. Thank you.
Excellent. Thank you both so much for that overview. We're going to move straight into questions because we have a number coming in and we have some that were submitted upon registration. So we'll start at the beginning and we'll work our way through them all. First question, and I apologize, my neighbor is cutting his grass and it's very loud. I hope you can't all hear that, but my house seems to be shaking. First question. So good morning and thank you for this event. Could you please give us direction on the employer's obligation on internal employee contact tracing, if this is an obligation? And so I think, Christine, that one might be for you.
Sure. So currently there is no specific health and safety regulation in regards to a pandemic or this specific pandemic. That being said, underneath the Occupational Health and Safety Act, employers have broad obligations to take all reasonable steps in order to protect the health and safety of their workers. So that would include putting up posters as is issued by the Durham Region and beyond, having a pandemic policy for how physical distancing is to be maintained in the workplace, how individuals are supposed to regularly wash hands, not share documents, and those sorts of things should all be in place. But in terms of actual tracking of, who has come into contact with whom, I think that would be something that it's a good idea, especially for any workplace that can't maintain physical distancing, to have a sense of which workstation workers are assigned to, so that if there is unfortunately a positive instance of COVID-19 in your workplace, you're able to identify who will need to self-isolate. And also the employees should be directed to take the self-assessment questionnaire as published by the Ontario government if there is a positive instance of COVID-19 in your workplace. But there is currently no obligation to record it. It is, though, a good idea if you do have workers who have to work in close contact to be making a note of who those workers are and who they are working with.
Thank you, Christine. Next question. What is the Durham Health Department's position and direction on the wearing of face masks or face shields in the non-medical workplace? Is there also a related position on heat exhaustion and concerns related to prolonged mask or shield usage?
It's Pepi. I can start this one. So currently, if people cannot physical distance, if you're not able to sort of keep that 2-meter distance, it's recommended that you wear a non-medical mask, certainly. Sometimes you don't know if you're going to be less than 2 meters from somebody. So for example, I don't always wear my mask because I'm outside, but I do keep one in my pocket at all times in case, people get too close or whatnot. You keep it pretty good about physical distancing. But yes, you want to wear a non-medical mask if you cannot physical distance. And the second question was about concerns about heat exhaustion with wearing a mask. Was that correct? So there are certain times people can't wear a mask. So for example, children, people with certain breathing difficulties, people who would not be able to take off a mask themselves, for example. But we know that many people wear a mask all day, surgeons wear a mask all day, many workers wear a mask all day, and I'm not aware that there's any concerns about heat exhaustion, for example, in healthcare workers, for example, who wear one 12 hours a day straight. So I haven't seen too much literature on that for heat exhaustion, but we definitely do want to wear a mask if we can't physical distance.
Excellent. And so that sort of segues into the next question. Can business owners then require their patrons to wear a mask?
So I think we can all answer this one in different ways. So certainly they can suggest it, but at this time, I think it would be difficult to mandate the wearing of a mask within your business. I don't know if Christine wants to weigh in on that.
Yeah, I'll just say that depending on the nature of your business, assuming that you have discretion over whether or not you allow customers or clients in and out of your business, you have the option then to refuse to serve individuals who aren't wearing a mask. It is recommended, though, to avoid discrimination on an economic basis. If that person has had issues with financially affording a mask, that you provide masks to individuals who don't have their own. And I know that there are some businesses who are even charging a fee for that, but then making a donation, and it's a dollar or so a nominal cost, just to avoid people wasting masks. But you can implement that depending on your business, but you should be mindful that you're not creating an accessibility issue with regards to your business.
Thank you. Excuse me. When will there be greater access to testing? People living in North Durham have to travel to Oshawa or Ajax for testing, or out of region to Markham-Stouffville Hospital. Will local testing for communities that don't live in the Lake Ridge catchment area be available soon?
So great question. So there was a great deal of information happening with Lake Ridge, with primary care providers, with people in Uxbridge, Port Perry, sort of scattered across the north, trying to think about how can we offer, as you mentioned, sort of more service, but also planning for the fall, right? So if we do start to see more COVID in the fall, if we do start to see, along with more influenza, our usual respiratory viruses in the fall, so it needs to be more integrated into the services we already use with that assessment piece. So that work is ongoing. We're thinking about mobile sites. So public health is one small part of this, but there is a lot of planning under the Durham Region it's called the steering committee. But there's a lot of work happening and a lot of big people making big decisions about what's going to happen for the fall. So I would say it's coming. Apologies, it's not here yet, but yes, there's soon should be greater access for everybody across Durham Region.
Excellent, thank you. What is the Durham Health Department's position on body temp screening requirements for employers? If it is a requirement, does this require a specific device? Is it considered a medical procedure to be handled by a trained, licensed medical person?
So Lisa and I can both take this on, but this is where that ministry sector-specific guidance website is extremely helpful. So most sectors now do have a guidance document about how you should be screening and what this looks like. In general, the temperature checks are not required unless it's a healthcare facility. And even then, not all healthcare facilities would require it. So if you are not suggested to do temperature checks by your sector-specific guidance document, I would not recommend it. It's not a perfect test. You need people to be able to do it properly. What does it mean if you have a positive? What happens if someone bikes to work and then their face is hot and then you get a raised temperature? Sometimes it's a little bit harder to interpret. So if your guidance specifically does not recommend it, I would not implement it. I would not recommend implementing it.
It's Lisa, if I can just add, so we do have a number of very good passive screening signs on the website that people can use, that they can display that on the front door for visitors as well. So typically what we'd recommend is kind of an active screening for staff, and then any visitors or workers or, like contract workers coming in, more of a passive screening. So again, on our website, there is a lot of great signage and information.
Thank you. I just wanted to clarify, so another question, just wanted to clarify that I've been told by my father's long-term care facility, or what I was told by the long-term care facility. I was told they would not be retesting him for COVID-19 after his 14-day isolation, now that he is back at his residence. Is this true? Sorry, back to his residence from the COVID-19 floor at Ajax Hospital. Is this true?
So the current recommendations are not to retest people who were previously positive, because they likely will show on a test that they can be positive. Some people can show up to 6 weeks after the test. It doesn't mean they currently have COVID or they're infectious. It means that the particles of the virus are in the back of the nose or the back of a throat. You can think of it as sort of a dead virus. It's there maybe in small quantities, and it would show up positive on a test, but you are not infectious and you would not be at risk to other people. So right now, we do not retest people who've been previously positive because it doesn't give us any good information. So what your father's long-term care home is suggesting would be in line with the current guidance.
Okay, thank you. Is there an obligation for office or warehouse facilities to change their management of air quality measurement or air quality standards due to COVID-19?
So I guess jump in on that one. So as far as I know, there isn't a requirement, but again, you have to look at what type of facility that you are looking at. And if there aren't any questions, we do recommend that you get in touch with an HVAC specialist to come in and review what is happening.
Okay. Is there a plan to move from 2 meters safe distancing to 1 meter in phase 3, similar to the UK plans announced recently? Or do you see the 2 meter distancing staying in place during stage 3?
That's a good question. I haven't seen anything yet about the 1 meter. We haven't, to be honest with you, I have not been thinking about phase 3 yet. I know it's out there, but really we've been focused on the work right now and sort of the week and 2 weeks ahead. But I haven't seen that yet. So it's a good thing to keep on the radar, but no, I think we like our 2 meters for now.
Excellent. Yes, I appreciate the positive outlook for stage 3, but you're right. We're here today. It's only been a week, I guess, as of tomorrow. So we'll continue day by day. With that, I do have another question regarding stage 3. Given the number of new cases for Durham Region, they're steadily declining. Based on this trend, can you enlighten us what can be reasonably expected once we move into stage 3? So maybe what stage 3 might look like once we get there.
That is a good question. Certainly more businesses open up, things that, you know, that still can't open up now will be the next phase, but I don't think we'll be back to normal. It'll be sort of the new normal, right? The physical distancing will remain, the masking if you're, you know, in close contact, the diligence to hand hygiene, which we've seen. I mean, our rates of influenza have been lower in the region. Like lots of really good things, reminders have come from this that we will take into the new normal. So I don't know if Lisa has any comments about phase 3, but a lot of that is just the next level of businesses that will open. But I have been sticking with phase 2. So if Lisa has another comment about phase 3.
No, but there is a great document that the province put out called a framework for reopening our province. And on the last page, it does talk about phase 3. And again, as Pepi had said, it's really talking about the opening of more businesses and amenities and services. What that may look like, it's hard to know. Even as far as like the size of gatherings, we really don't have an understanding of when that will be, I guess, expanded. Given that the Premier extended the state of emergency yesterday, I suspect we won't hear too much more until after that. So that would be the middle of July.
Okay, thank you. Excuse me. Can you request an inspection or consultation to ensure you are meeting standards for reopening your business? If so, is there a cost? If not, is the health department accessible in other ways to businesses seeking clarity on ministry guidelines?
So I can take that one. So yes, you can call our Durham Health Connection line and speak to a public health inspector. So depending on the type of business that you're asking about, we don't have expertise in everything. So for example, if an auto body shop called us and wanted to know, about their different practices, we probably wouldn't be able to, provide detailed guidance on that. Obviously for personal service settings, restaurants, swimming pools, all those type of things that we do inspect, we are able to help provide that. We really do kind of rely on our main messaging. We encourage, every business to have some type of screening for staff and visitors. Hand hygiene is key, physical distancing plan, encouraging people to stay home if they're sick. So those are, physical and, the use of masks. So at least to have a plan for when staff or even visitors have masks. So at least to have that under consideration. So those are the main messages that we tell everyone, regardless of whether it's a community or whether it's an auto body shop, just to have those things for consideration.
Okay. And a follow-up.
No cost.
No cost.
No.
And just a follow-up, you mentioned in your presentation, portion of the presentation, Lisa, about risk assessment, and you recommended businesses do that. So could you speak just a little bit more on how, where to start? Is there a document for guidelines on how to go about risk assessment for your business?
Yes, actually, there is a very good document on the ministry website that actually it's a template for businesses to go through and to kind of help them to develop their own safety plan. But again, it's questions, like the type of service they offer. So again, like a personal service setting where you're very close to someone is obviously going to have a higher risk than someone running an auto body shop, for example, right? So those are the considerations. Is physical distancing possible among, people that come in, even among the employees? So again, those are things, is hand washing readily available? So those are the type of things that you would need to walk through. A lot of people have gone to teleworking. So do you have to have that employee in, or can they continue working, right? So there's all those kind of, physical distancing. If you can't physical distance, can you put up plexiglass barriers? So I'm happy to send you some links to all these resources that we're talking about, and then you can send them out, because I know there is a lot of information.
Yes, that would be fantastic. We will certainly do that with the recording of the presentation as well.
Okay, great.
Couple more questions. Will public pools and splash pads be opened for use this summer in Durham Region?
Yes, so with going into phase 2, we are able to open. We do have a number that have already opened. I think we only had one that wanted to open the first day. And slowly people have been starting to open. So it really is at the discretion of the owner to decide if they want to open. They do require an inspection by a public health inspector prior to opening. And so our current process is they would contact our Durham Health Connection line, speak with an inspector. The inspector would review the requirements that they need to have. Then an appointment is set up, and then the inspector goes out and opens the pool.
Okay, so a couple of steps required first, but yes, we have something to look forward to.
Yes.
Christine, is there a free template available to employers to help with their pandemic policy development or revision? And I think you actually just put something into the chat box.
Yeah, so further what to Dr. Fortuna was mentioning, recently the Ministry of Labor released a guide that employers can walk through in order to develop their own COVID-19 policy. This guide doesn't have any template in it, there's no sample policy, but the idea is that each workplace is unique, whether or not, for example, your workers are working predominantly remotely, with or without being able to maintain physical distancing, and all of those different factors. The Ministry of Labor is currently in the position that they can't provide the actual content of the policy for you. But if you effectively go through this, sort of turn your mind to all the different questions that should be answered, you should be able to develop a policy. I'd recommend at the same time that you're going through this, you take the time to read through the sector relevant guidelines the Ministry of Labor has shared, as has been created by other agencies and associations. And you can even form your policy as a way of answering those questions. So normally the policies that I'm preparing, they start with things like, how are we going to stay safe? What if someone wants to come and visit the workplace? And those sorts of things, and then just has bullets in terms of what they're supposed to be doing.
Okay, thank you. And again, we'll go through the chat at the end and we'll take out all of the links provided and we'll circulate that after the presentation. There was another question in the chat that I've just noticed. Will day programs for special needs, the special needs community be available or be opening soon? This is from Francie. She owns Tanya's Place and we are finding it difficult right now.
I'm not sure if I have the answer to that one. I know that day camps are allowed to open. Yeah, unfortunately, I don't have the answer to that one. We can certainly look that up unless Pepi knows.
I don't know unless they're allowed to use the same camps guideline, Lisa.
Yeah, I'm not sure.
Okay, so Francie, if you are listening, we'll follow up with you absolutely on that. Another question, are employers required to screen employees by questionnaire on COVID-19 symptoms on a daily basis as they return to work in the office? If so, are these to be kept on file and are there any privacy considerations?
So this might be a Christine question, but the general answer is yes. So if you look at all the guidance documents, it does say that people should be screening their employees. What that means for each organization is a little bit different. For example, you could just have your employees attest that yes, they've done the ministry online screening form, which is always sort of the more up-to-date version. So you could have your employees say, yes, I've done the online form, I'm okay to present to work, in which case you wouldn't actually be collecting any of the information. But all of the sector-specific guidance does recommend that there is screening done for your employees. So I don't know if Christine has anything else to add.
Sure, thank you. I just said, so there's no, as I mentioned before, there's no specific amendments to the Occupational Health and Safety Act that says you have to do this or you don't have to do this. But because you have to do everything that's reasonable, if it's in a guideline that you should do something, then you should be doing it. In terms of how to do the self-assess, how to have employees or workers do the self-assessment, I would recommend that it be clear in the COVID-19 policies and procedures that you implement that all employees are expected to self-assess and to watch for any symptoms on a daily basis. And if they have any concerns or questions at all, they should be taking that self-assessment questionnaire and determining whether or not they should be isolating. And that includes even during the workday. If during the workday they find that their symptoms change, they should take the self-assessment questionnaire. I wouldn't recommend that you ask any individual those questions because of, first and foremost, health privacy concerns. And you don't really need to know that information, what the answers are, because depending on what the answers are to the questions, it may be that they still don't need to self-isolate. So I wouldn't recommend that you ask them that information. I'd also be reluctant to require a daily sort of log where individuals sign off that they have self-assessed. The issue is that as an employer, because you have an obligation to take all reasonable steps, if you take the position, it is a reasonable step for me to have everyone check off a daily log each day, and then you go a period of time where you forget about it, you don't do it, someone tests positive, the Ministry of Labour lays charges later on that you failed to take reasonable steps. It's going to be very hard to show to a court why, 20 days ago you thought this was reasonable and then you stopped doing it. So I would recommend that whatever policy or procedure that you implement in terms of ensuring that your workers are self-assessing, that it's something that you can continue to follow through on for the next, however long we remain underneath this.
And there just was a question popped into the chat to follow up. If you don't have a log, how do you prove due diligence?
So you would prove due diligence by showing that you have a policy in place, that policy was clearly communicated to your workers. So I would recommend that policy be somewhere between 1 to 5 pages, that it would be posted throughout the workplace, that it'd be available on your business's intranet if you have individuals working remotely, that you would do something like hold a Zoom team meeting where you would go over with people, reminding them about what the policy is, walking them through it. You should treat it like any other workplace hazard, right? If you have individuals in your workplace that are operating forklifts or a dangerous tool, you would take those same kind of steps, right? You would explain to them what the hazard is, what steps we all have to take to keep safe. And then every now and then you would have those reminder meetings. In the construction industry, we call them toolbox, where we have that discussion before the start of the workday, just reminding everyone. And you can take that opportunity when something comes up, like if someone happens to notice someone else is coughing in the workplace, just send out a reminder again. Even here at our own firm, we send out fairly regular reminders just saying, have a great long weekend, everyone, or, just as a reminder, if anything comes up during the weekend, or if you have any changes in your health, let us know, and that sort of thing. Just those kind of friendly reminders, and all of that, those emails, the Zoom meeting, that policy, all of those together would then form your due diligence evidence in the event that the ministry laid charges.
Okay, thank you, Christine. Another question just found in the chat. Given all of the research pointing to the benefits of wearing masks, why hasn't there been a province-wide mandate? And I'm not sure if we can answer that portion, but if not provincial, why hasn't there been a regional mandate to enforce wearing masks?
So it's a good question. So the evidence on mask wearing on a large scale is good. It's not great. There is better evidence for the things we are already doing, the public health measures, the physical distancing, the hand hygiene, the cough etiquette, right? Not coughing into your hands, but coughing into a tissue or your elbow. All these things have more evidence than the mandatory masking. It is certainly something that could be considered. We do take direction centrally from the province. Where this would differ is if there would be a local context where people would be at higher risk. For example, right now in Windsor, where they've mandated it for businesses, it's a different context right in Windsor right now, right? They're dealing with, quite a big outbreak in their migrant farm workers, so a bit of a different context that we're not seeing here in Durham. The orders that were to happen if you were to make it mandatory, if you make things mandatory, they have to be enforced. And then the question becomes, who actually does that enforcing? And then if we're not actually going to be enforcing it, like if police are not going to show up, or bylaw officers or the health department, to give you a ticket, then why mandate it if you're not actually going to enforce it? What that becomes then is a strong recommendation, which is actually what we have right now, a strong recommendation to wear a mask if you can't physical distance. So right now, I would say that's not in the cards. Dr. Kyle may wish to chime in, but until we see that direction provincially, or we see that there would be a greater need. For example, all of a sudden there was a tremendous increase in cases and we were extremely worried that, for example, businesses were the cause of this concern, perhaps it'd be something to consider, but it's not something that we are considering at this time.
Nicole, what I would add is I believe there isn't a province-wide mandate for the very reason that Pepi just described, that in fact it would be unenforceable, and those resources that are available to enforce emergency orders are focused on other priorities such as social gathering. Locally, from an enforcement perspective, and Lisa can speak to this, we have focused our enforcement efforts with respect to, for example, institutions in outbreaks, with respect to positive cases that are in self-isolation, and most recently, we've issued orders with respect to the migrant farm worker situation, which of course is quite acute in southwestern Ontario. So again, not enforceable either provincially or locally. And in addition, there are other priorities that really command the attention of and efforts of limited enforcement to staff. So I completely agree with Pepi that if something is not enforceable, then it's a strong recommendation, and we're already on record as strongly recommending the use of masks in non-healthcare settings where physical distancing is not practical.
Okay, thank you very much. So I'd like to we have a question here about second wave. And so the reality of that situation of a second wave coming in the fall, and if it does, and I know we can't predict the future, but do we think it will hit us in the same way?
So very real possibility. We are all planning for it because we are all thinking that it is going to come. Could it be worse because it will hit at a time when we have our other seasonal respiratory viruses, influenza, other coronaviruses? So yes, we are concerned about the second wave. We're all planning for it over the summer. Yes.
So Nicole, what I would add is that we have repeatedly said that COVID-19 is a marathon. It's not a sprint. As recovery moves to stage 3 and then to phase 3, and as there is more mixing and matching of those who are infected and possibly transmitting and those who are not immune, particularly as you widen social mixing. In other words, the social gathering restrictions become loosened. As you're looking at allowing there to be more indoor gatherings, more social events, etc., the fact remains that transmission is still smoldering in Durham Region. The fact is that most people are not immune. And once we not only widen the number of opportunities for those who are exposed and transmitting and those who aren't, there's the whole spectrum of international travel. And the possibility of importing COVID-19 back into Canada and Ontario. So will the second wave be the same as the first wave? The hope is no, because you do have herd immunity, if you will, sort of taking hold. But it may be complicated by other respiratory illnesses that occur in the fall, particularly in the run into the flu season. And the great hope with respect to stopping the pandemic is the availability of vaccine, and that's probably a year or two, pure speculation on my part, away. So all the more reason to continue to be vigilant with respect to public health measures, and you've heard them: hand hygiene, respiratory etiquette, physical distancing, social distancing, and so forth. Will there be a massive wave, or will there be, I'm going to say, hot spots with respect to where there are outbreaks, much like has been in the case with the first wave, particularly around institutions? It's likely to be similar, but perhaps less intense. And we, of course, will keep a close eye on transmission and continue our surveillance activities and so forth. So that's what I would say with respect to the second wave. Pepi or Lisa may have other comments to add.
So a very real possibility. Thank you. One question's just popped up in the Q&A. Further to the question and concern about migrant workers, are we experiencing any COVID-19 positive cases in Durham Region migrant workers? So in Brock Township farms and or East Durham farms production areas?
So right now we've been testing for about the past week. The paramedics have gone out to the farms and they've been doing this surveillance testing. So far we have not received any positive tests, which is wonderful. I would say the testing is ongoing, so perhaps we could see cases. But right now there have been no outbreaks within Durham Region, which has been wonderful. I did read in the news this morning actually that York Region has their first positive case in the migrant farm workers. So if you seek, you shall find, right? The more you look, you're going to find it. Here we look for it, unlike the US, where don't test, don't find it. So we're doing this because we want to find outbreaks, right? We want to make sure that the population is safe. So if we find it, we will deal with it. But right now there has been none so far in Durham Region.
Some good news. Thank you. And just as we approach the hour, we have a couple more questions we'll get through hopefully very quickly. One I think pertains to everybody. With lack of hand sanitizer and cleaning sprays available due to supply chain issues, can we substitute a dilution of alcohol and water to mist devices or bleach and water? Any recommendations there?
So I actually have a very long answer for that, so I'm happy to send it to you after. So really, I mean, there's a couple of things that we want to talk about when we're talking about cleaning devices. I mean, one of them is how often do we do it? So if it's a high touch device or a device that's shared, it would be between uses, obviously. But it, otherwise it's, recommended twice a day or when there's visible dirt on it. So it's important to use a product that is registered through Health Canada. So every product that has a drug identification number would be considered safe. But I do recognize that there is a shortage. Public Health Ontario has a great tool on their website that explains to you how to calculate the dilution for bleach and water. So I advise you to look at that. And I guess the other important thing to remember when cleaning devices is, to make sure you read the label, because you don't want it corroding or wrecking anything. So that's the other piece. But again, I'm happy to send you the more detailed response.
Thank you. We appreciate that.
Nicole, what I would add is if your viewers go to Health Canada's website, I'm aware in June of 4 health hazard notices from Health Canada, with respect to health hazards posed by certain hand sanitizers. So not only is there the substitute, but there are some that perhaps don't have a good safety profile. So buyer beware, and Health Canada is a good source of information in that regard.
Excellent. One question, and this will be for you, Christine, that we are receiving very frequently is, what if an employee says it's not safe to work or to return to work? What are the steps you recommend an employer takes?
So there's 3 laws that overlap in this area. They are the Occupational Health and Safety Act, the Human Rights Code, and the Employment Standards Act. So the first thing you need to determine as an employer when someone is refusing to come back into the workplace is whether or not they're refusing because of a concern about the health and safety practices of the workplace, or if their concern is because of their own health issues, or if it's simply because they just don't feel safe. You know, they've been watching a lot of news and they're freaking out. So if it's the first one, if it's because of their concern about the workplace's health and safety practices, then you're falling underneath the umbrella of the Occupational Health and Safety Act. You would need to address that concern. So take a look, make sure you have the policies and procedures in place, posters up, you provided the training that you should have, and then you respond to the employee either confirming, no, we're meeting everything we need to do under the Occupational Health and Safety Act. Yes, we weren't meeting it all, but we are now. And then the employee has to decide whether or not they still maintain their work refusal. If they still maintain their work refusal, then the Ministry of Labor needs to be contacted for them to make a determination as to whether or not there is any basis to the work refusal. If the Ministry of Labor concludes that the Occupational Health and Safety Act is not being complied with, then as an employer, you'll be ordered to ensure compliance. And then once that compliance is achieved, the worker is then to return back to work. So that's the first type of piece. The second piece is if an individual is claiming is refusing to come back into work because of their own health and safety concerns. So they might have a compromised immune system and they've been recommended, for example, by their doctor to continue to work remotely as long as the pandemic is going on. If that's the case, then you as an employer have a duty to accommodate that disability underneath the Human Rights Code up to the point of undue hardship. And you are able to obtain documentation, reasonable documentation, in order to satisfy yourself as to what that accommodation needs to look like. So for example, it could be because of that individual's disability or health concerns, or a health concern of a family member that resides with them, that they can only come into the workplace if physical distancing can be maintained. So it could be that they need to be assigned to a different job or a different location within the workplace. Or it might be that they cannot come into the workplace even with accommodation, and then accommodation would take the form of allowing them to work remotely. If their job can't be done remotely though, and they can't be accommodated in the workplace, then they might be placed on approved unpaid leave of absence. And then finally, that third category of, I've just been watching too much news, I'm freaked out, I don't want to come back into the workplace. You should be mindful that underneath the Employment Standards Act, individuals, in addition to the new emergency infectious disease leave under section 50.1, also have a general entitlement to sort of, I'll call them personal days, 3 unpaid personal days and 3 unpaid family days. So at minimum, everyone in Ontario effectively can take 6 unpaid days off if they need to because of concerns about the pandemic.
And can you ask for a doctor's note?
So you can't ask for a doctor's note in regards to the infectious disease underneath the Employment Standards Act, but you can ask for it in regards to a human rights accommodation underneath the Human Rights Code. So essentially what that means is if someone comes to you and says, public health has told me that I need to self-isolate, and they're therefore claiming a section 50.1 leave, you can't ask them for a doctor's note, but hopefully they would have some sort of communication or other reasonable documentation from public health that they can show you in order to establish that they qualify for that leave. If though someone's asking for accommodation because of their own personal health issues, then you're allowed to ask for reasonable documentation or a doctor's note. I would recommend against though simply requiring doctor's notes for the sake of doctor's notes. Our healthcare system is very stressed underneath these circumstances, and really you should only be asking for what you actually really need in order to respond to the request.
Okay, thank you, Christine. And that brings us to the top of the hour. I want to say to all of you, Dr. Kyle, Dr. McTavish, Lisa, Christine, thank you so much for spending this hour with us, answering our questions. Certainly have learned there's many resources available, and so we will be going through the chat, take those links out, and following up any questions that may not have been answered, and we'll send them all to our attendees after the presentation. Again, very much appreciated. It's all about education and communication, and I think as we move forward and practice our safe health, hand washing, and physical distancing, we will be able to get through this. So again, to you all, thank you so much. And to our attendees, thank you for attending today. We will see you very soon, and I will say bye for now. Have a good day.